Multiple myeloma is one of the challenging disease to diagnose in clinical practice. After differentiating it from the other similar disease like the monoclonal gammopathy of undetermined significance, that is MGUS, smoldering multiple myeloma, etc., and Waldenstrom macroglobulinemia also. So in clinical practice, we have to diagnose the case of multiple myeloma, and also I have to differentiate it from the similar diseases that I have mentioned. So if you think about an important scenario like how a multiple myeloma can present to you, or how you can diagnose the case of multiple myeloma. So if you think the scenario, how the scenario will be. If I say an elderly people present with you with anemia, features of anemia, features of hyperviscosity, having his complete blood count with anemia of normocytic normochromic anemia, or it can be also macrocytic anemia and high ESR. There will be high ESR, generalized body pain. In this scenario, you'll have an important differential like the multiple myeloma. If I say an elderly people present with you with anemia, features of anemia, features of hyperviscosity, but he's having lymphoid involvement, like he's having lymphadenopathy, splenomegaly. So in this case, you'll have to think about the Waldenstrom macroglobulinemia. So how these similar diseases present and how you can differentiate them is very challenging in clinical practice. So first we'll make this confusion clear. Okay. So before we jump into the main section, we'll have to know some basic regarding paraprotein. Okay. So first of all, what is a paraprotein? The normal immunoglobulin has two light chain and two heavy chain. As you can see here, this is the two heavy chain and this is the two light chain. This is a normal immunoglobulin having two heavy chain and two light chain. And you see they are connected with some bond here. You see, the heavy chain can be of IgG, IgA, M, D, and E. And the light chain can be kappa and lambda. So if there is only one heavy chain and one light chain, that will be a paraprotein. Okay, so this segment that I'm marking here, if an immunoglobulin present with this segment, just one heavy chain and one light chain, it will be a paraprotein. There's no confusion, right? A normal immunoglobulin has two heavy chain and two light chain, but the paraprotein, they have only one heavy chain and one light chain. This is the paraprotein, or you can other way say it like M protein. Okay, the M protein. Okay, so on the serum protein electrophoresis, there are some interpretations. Like you can see here, the serum protein electrophoresis showing the waves of albumin, alpha 1, alpha 2, beta, and gamma. These are proteins, okay? So albumin wave is longer than the other. And these segments are the globulin protein segment, okay? This segment is globulin protein segment. So alpha 1 globulin, alpha 2 globulin, beta globulin, and gamma globulin. So on the alpha 1 globulin segment, the components are this. On the alpha 2 globulin segments, the components are like ceruloplasmin, alpha 2 macroglobulin, antithrombin 3, haptoglobin. Okay. On the beta globulin segment, the beta 1, the transferrin, beta 2, beta lipoprotein, and other. Okay. On the gamma segment, the gamma globulin, you see the immunoglobulins like IgA that is closer to beta region, IgM between the beta and gamma region, and IgG throughout the gamma region. Okay, so these are the components of the different uh, proteins that are shown in this figure. So the waves you see here are the normal interpretations. Okay, so albumin wave is higher than the other. If we see another electrophoresis, serum protein electrophoresis here, you see the blue region are the normal presentation. Okay, so albumin you are seeing here the high up here, the alpha 1 segment, alpha 2 segment, beta segment, and the gamma segment. Okay, the normal, the you see the blue pattern will be the normal. Okay, but if you see the yellow segment, the yellow waves like the albumin here, the alpha 1 segment up to this alpha 2 beta, and the gamma segment shows sharp rise. Okay, this. So if you consider the yellow waves, it shows a differential of multiple myeloma. Okay, so if a serum protein electrophoresis present with the blue waves, it will be a normal. But if it presents with the yellow waves like this, the two spike you see here, the albumin spike here, and the gamma globulin spike here. Okay, the sharp rise. Okay, so you will have a differential like multiple myeloma. Okay, but you cannot determine the diagnosis of multiple myeloma but just by seeing this serum electrophoresis. Okay, with with this rise, in the gamma segment, you just cannot confirm your diagnosis with multiple myeloma. There are some other clinical features and other findings. Okay, so what are similar diseases? There are the main playing ground here with the multiple myeloma. When you're dealing with the case of multiple myeloma, this is the main playground we have to play with. Okay, that is monoclonal gammopathy of undetermined significance, smoldering multiple myeloma. This is multiple myeloma, and here Waldenstrom macroglobulinemia. This is the main playground. Okay, this is the main playground of your multiple myeloma. You have to differentiate them as well as diagnose them. Otherwise, you can make confusion with the diagnosis. Okay, so let's discuss regarding this playground that I have mentioned here. So the monoclonal gammopathy of undetermined significance, or MGUS in short we say, the MGUS, SMM. First of all, the M protein in serum will be less than 30 gram per liter in case of MGUS. You remember, in the MGUS, everything will be less. Okay, M protein or the paraprotein concentration in serum is less than 30 gram per liter in case of MGUS. Okay, and the bone marrow clonal plasma cell is less than 10%. So this is the two important parameters like 30 and 10. We have to remember these two segments very carefully while you are dealing with the multiple myeloma. So on the MGUS segment, everything will be less. Okay, the M protein concentration or paraprotein concentration in serum is less than 30 gram per liter. The bone marrow clonal plasma cell is less than 10%, and there will be no crab. So what is a crab? Crab means some features like C means the calcium, R means the renal impairment, A means anemia, and B means the bone lesion like the skeletal lytic lesion or the osteoporosis with compression fracture that can be seen on MRI or other imaging test. Okay, so what is crab? C means calcium, that is hypercalcemia. C means calcium, that is hypercalcemia. R means renal impairment. Okay, renal impairment like the serum creatinine can be raised. Okay, the anemia. Okay, anemia, the hemoglobin has been reduced. Okay, the skeletal lytic lesion, it can be on the skull like lytic lesion on the skull, or it can be osteoporosis with compression fracture. Okay, so these are the crab. In short, we say crab. Okay, so there will be no crab. So there will be no hypercalcemia, there will be no renal impairment, there will be no anemia, there will be no skeletal lesion. Okay, no bone lesion. The bone marrow clonal plasma cell less than 10%, and M protein or paraprotein concentration in serum is less than 30 gram per liter. So this will be the monoclonal gammopathy of undetermined significance. Okay, but if you see here the small learning multiple myeloma SMM, it will have these parameters increased like M protein concentration in serum is 30 or more than 30. Okay, 30 gram per liter or more than it. This will be in this segment. The bone marrow clonal plasma cell is 10% or more than 10% in case of SMM. Still, there will be no crab. Okay, no crab in SMM. So it differentiates by these parameters. Okay, now, on the multiple myeloma segment, you see there will be M protein or paraprotein in the serum or urine. Okay, the bone marrow clonal plasma cell will be present, and there will be features of crab. The crab is called the target organ impairment. So features of target organ impairment or crab is present in case of multiple myeloma, not in the monoclonal gammopathy of undetermined significance, or that is MGUS, or in case of SMM. These two, there will be no target organ impairment. Okay, but in case of multiple myeloma, there will be target organ impairment or features of crab. Okay, Now, the confusing part of Waldenstrom macroglobulinemia. The main features here, you can differentiate it from the multiple myeloma with the lymphoid tissue involvement. Lymphoid tissue involvement is uh, more diagnostic for the Waldenstrom macroglobulinemia. Okay, here can be the anemia as well as the some features of hyperviscosity. The multiple myeloma segment, it also have anemia and features of hyperviscosity. Okay, so anemia and features of hyperviscosity are uh, both can present on multiple myeloma and Waldenstrom macroglobulinemia. Okay, but on the Waldenstrom macroglobulinemia, here is involvement of lymphoid tissues. This is the differentiating point from the multiple myeloma. Okay, so here is IgM paraprotein in the serum. Okay, this is the IgM paraprotein in the serum. Okay, the IgM is one of the paraprotein. Okay, so IgM can also be present in multiple myeloma. Okay, and Waldenstrom macroglobulina is exclusively for this IgM paraprotein. Okay, so IgM paraprotein is can be in both in case of multiple myeloma or Waldenstrom macroglobulinemia. Okay, here bone marrow lymphoplasmacytic cell, bone marrow lymphoplasmacytic cell more than 10% in case of WM. Okay, now important feature like there will be no CB. CB means C means, you remember here, C means the calcium. Okay, C means the calcium. So there will be no hypercalcemia, and B means bone lesion. You see here the bone lesion. There will be no bone lesion also. So CB is absent. Hypercalcemia and bone lesion is absent in case of Waldenstrom macroglobulinemia. But RA, you remember RA? So R means renal impairment, A means anemia. Anemia can be present in Waldenstrom macroglobulinemia. Renal impairment can be present also in Waldenstrom macroglobulinemia, but renal impairment is not very common in Waldenstrom macroglobulinemia. Okay, so it is less than the multiple myeloma. Renal involvement can occur in Waldenstrom macroglobulinemia, but it is not common. Okay, it is less than multiple myeloma. You have to remember. Okay, so there will be absolutely no hypocalcemia and no bone lesion. Okay, but there can be renal impairment, but it is not common, and there can be anemia. Okay, the important criteria is this: the lymphadenopathy and hepatosplenomegaly, or it can also have splenomegaly. Okay, so lymphoid tissue involvement is very important. Like in the bone marrow, it also have lymphoid involvement. Like there is lymphoplasmacytic cell in the bone marrow. Okay, so you see here the lymphoid. Okay, and also the lymphadenopathy, hepatosplenomegaly or splenomegaly. So lymphoid involvement will be in case of Waldenstrom macroglobulinemia. Okay, so if you think about the scenario like an elderly man present to you with features of hyperviscosity as well as the features of anemia, and you do the complete blood count, on the report you see the hemoglobin is reduced, that is anemia, and there is high SR. So you'll have a differential like multiple myeloma, or it can be Waldenstrom macroglobulinemia. Okay, so if these people on examination you find he's having lymphadenopathy or hepatosplenomegaly or splenomegaly, so you can primarily uh, diagnose the case of Waldenstrom macroglobulinemia. Okay, so you do the other parameters like paraprotein and the bone marrow. So you can say it Waldenstrom macroglobulinemia. Okay. Okay. Now there is another term that is POEMS. It also have a lymphoid involvement. Like POEMS means polyneuropathy, organomegaly, endocrinopathy, multiple myeloma, and skin involvement. So what are the features? Like polyneuropathy plus organomegaly, it can be liver, spleen, lymph node plus endocrinopathy. So how the endocrinopathy can present, like in case of women there can be amenorrhea, in case of male there can be impotency, gynecomastia. There can be other features also like the type 2 diabetes mellitus, hypothyroidism, hypothyroidism, adrenal insufficiency. These are the evidence of endocrinopathy. So evidence of endocrinopathy can be present, plus the multiple myeloma, plus the skin involvement. Like you can see the clubbing, you can see the hyperpigmentation. So all these, if these all are present, polyneuropathy, organ involvement, endocrinopathy, multiple myeloma, and skin involvement. So this can be POEMS. Okay. So here is also like organomegaly, like liver, spleen, lymph node involvement. Now, the solitary plasmacytoma of bone, what is this? The single area of bone destruction due to clonal plasma cell. Okay, there is only single area having bone destruction, and it is due to clonal plasma cell, but there will be no M protein in serum or urine. If you do the bone marrow examination, there will be no myeloma like picture. If you do the skeletal survey, there will be no abnormality. And for the crab, there will be no crab, like no hypercalcemia, no renal impairment, no anemia, and no bone involvement, except only single area of bone destruction is present. So on the B segment, like bone lesion, it has only single area of bone destruction due to clonal plasma cell. But if you do the skeletal survey, it will be normal. Okay, only single area of bone destruction. This will be solitary plasmacytoma. Okay. Now, as we have mentioned that the MGUS, the monoclonal gammopathy of undetermined significance, and smoldering multiple myeloma, these are the precursor conditions of the multiple myeloma. These can turn into multiple myeloma. Okay, the 1% people with MGUS per year will develop the myeloma. Okay, and for the smoldering multiple myeloma, the risk of smoldering multiple myeloma to convert into multiple myeloma is 10%. So for the MGUS, it is 1%, and for the smoldering multiple myeloma, this is 10%. Okay. Now, the features of multiple myeloma. So the features can be summarized in simple way. Okay, as the people can have anemia, so there will be features of anemia. Okay, like there can be generalized weakness, fatigue, there can be anemic heart failure also. So what type of anemia you find in multiple myeloma? It can be normocomic normocytic anemia with normal or decreased reticulocyte. Okay, if there is normocomic normocytic anemia, the reticulocyte will not be increased. You have to remember, in case of multiple myeloma, if there is normocomic normocytic anemia, the reticulocyte will be either normal or decreased, but not increased. Okay, the anemia can also be macrocytic type in case of multiple myeloma. There can be pancytopenia. All three series of cells can be reduced. Okay, so on the pancytopenia, there is anemia, leukopenia, as well as thrombocytopenia. So the features of anemia can be present, plus as there is leukopenia, there can be infection, and as there is thrombocytopenia, there can be bruising or the bleeding manifestation. Okay, important features of hyperviscosity can be present. This is very important. Like it can present with nosebleed, bruising, delirium, visual disturbance, engorged retinal vein, retinal blades. Okay, and the hypercalcemia. Okay, hypercalcemia, you can summarize it like bones, groans, moans, and stones. Okay, these are the features of hypercalcemia. So, what is bone? Bone means the bony pain, hypercalcemia, and the liticulations. The groans, that is abdominal pain, constipation, etc. Moans, that is psychiatric problem. Stones, it can cause renal stone, urethral nephropathy, renal impairment. So with the bones, groans, moans, and stones, you can summarize the here other features of multiple myeloma also. Okay, you can remember with these mnemonics, like the patient can have bony pain. There is hypercalcemia. It is one of the features of crab. You see the lytic lesion or the bone lesion. There is B. Okay, the groans, there can be abdominal pain, constipation. These are the features of hypercalcemia. Mosaic is a psychiatric problem. This is also the feature of hypercalcemia. And the stones, you see, the stones, renal stone, urethral nephropathy, renal impairment. It is renal impairment is also the feature of crab. Another feature of crab, that is anemia. Okay, so the crab is very important feature. It is the feature of end organ damage. Okay, or tissue impairment evidence, the crab. This is very important for identify the differentials of multiple myeloma.